The World Health Organization characterized COVID-19 as a pandemic on March 11th. According to the WHO, COVID-19 does not discriminate between nationalities, ethnicities, or ideologies. Dr. Hodnett, a family medicine doctor from Cibolo Family Medicine, explains what is COVID-19 and where did it come from.
So COVID-19, that distinction means that it's a new type of what's called a coronavirus. So coronavirus is something that we've known has existed, much like we've known about various viruses cause the cold or the flu virus. But this particular one is what we call a novel virus, meaning it's one that we've never seen before, first described in China. We don't know exactly where it came from. We suspect that perhaps it jumped from maybe some type of animal into the human, which is why it's brand new.
San Antonio and Bexar County's stay home and work safe orders have been in effect since March 24th, ordering residents to practice social distancing.
And if we're trying to halt the progression of this disease that can be spread, then we're trying to do that by limiting people's contact with one another when that can be spread.
Dr. Hodnett says the orders are a good way to prevent the spread of the coronavirus.
What we also know is that this virus can also be spread in people who are asymptomatic, which complicates the picture, meaning that there can be people who are spreading the virus that don't realize that they're sick, which is why that governments and public health officials are taking further precautions, currently telling more people to not gather in large gatherings.
There are 3 ways to help stop the spread of the coronavirus. The first step is to wash your hands frequently. Second is to avoid touching your eyes, mouth, and nose. And third is to avoid crowded places. Anyone over the age of 10 in San Antonio must wear a face covering in public spaces, according to a new order in Bexar County that will go in effect on April 20th. I'm Armando Villarreal, Enlace.